Welcome to Wellness Health Services Health Talks. I'm Dr. Joshua Derito, a family physician with interest in public health, cancer care, and cancer prevention. In this video, we are going to look at the care that is given to patients who have sustained a stroke. And we'll look at what happens in a stroke, what are the complications that happen, and how do we need to take care of these people when they get a stroke. So a stroke is brain damage due to interrupted blood supply to the brain. This can be ischemic, it can be hemorrhagic, or it can be a transient ischemic attack. It is one of the leading causes of disability and is the second leading cause of death worldwide. So how do we recognize stroke symptoms? We have facial drooping, arm weakness, slurring of speech, and of course time is very necessary. So remember the first acronym. So you may also have headache, confusion, vision loss, and also imbalance. So immediate care include the golden hour actions. One is calling the emergency service so that you get to the hospital or to a health care as soon as possible. Ensure that the individual has an open airway, is breathing okay, and circulation is okay. It is necessary to record the time of onset of the symptoms and then transport the individual to the hospital. In the hospital, there will be the diagnosis, which will include CT scans, MRI, blood test, and an ECG to check on the rhythm. The treatment will include for ischemic stroke will be thrombolysis, and also thrombectomy, which is removal of the clot. And of course, for hemorrhagic stroke, it is blood pressure management, and if needed, surgery can be indicated. Then you have the rehabilitation and prevention. The rehabilitation include physical rehabilitation, occupational, and speech therapy. Then prevention will include medication like antiplatelets, the statins, and also anticoagulants. Then there is lifestyle modification, smoking cessation, diet modification, exercise, and the blood sugar and the blood pressure control. There is a need for the psychosocial support of the individual, and this will address the emotional challenges like depression. There is need for family education on how to take the care of the individual who has sustained a stroke. This will include turning so that they don't get pressure sores, exercises to the limbs so that we try to get them back to normal lifestyle. And of course, there is also an adjustment of the environment so that they can be able to do as much as possible the activities of daily living. We need to promote independence and safety as much as possible. So it is necessary to be very careful when you are feeding these individuals. Make sure they are well seated upright, and they also give them time to chew their food slowly, because the swallowing reflex might be affected, and if you try to force things so fast, then you may get them into aspiration pneumonia. Then there is also need to keep them turned, if possible, using adjusting their beds so that they do not get pressure sores. Use of a lipo mattress will help to prevent these individuals from getting pressure sores. Of course, there is need to prevent also the risk of getting clots in the legs. So there is need for exercises, use of compressive stockings, and also use of antithrombolytics to prevent them from getting DVT, because when you get a stroke, a DVT is a big risk. Then there is need to educate caregivers about warning signs and the possibility of a recurrence of the stroke. So it is important to recognize stroke, treat them on time, rehabilitate the individuals, and please remember the first acronym so that you recognize it and you take the necessary precaution. So I encourage you to subscribe for more health related content, and like and share and comment on the link below this video. Thank you for watching.